Okay, this is Maureen O'Hara again. I finished up with, in the last segment, with Dr. Yavari's patients. Now I'm going to move on. Here I typed in SZ for Dr. Slosich. Then I clicked on current device, and then her patient menu comes up here. And this is how I found out what the different diagnoses were. These are all assigned to ODA, but sometimes they're assigned to medicine. Many times, if they're diabetics and they either have this foot infection diagnosis or cellulitis, they're still admitted to ODA, and then you need to go check and make sure they don't have any foot issues and just write a note to that effect. Here is Dr. Slosich patient census. This is from Monday, February 14th. As you can see, they haven't been reassigned. But I was highly suspicious of this particular one. This is kind of ominous here. We usually don't take care of hardware. Dr. Shaw is the service chief for endocrinology, and I don't believe she is taking care of inpatients anymore. But you may still see her name. Her picture is in the office. Okay, the other way you can look up patients, which is handy to see if patients have been moved, which is frequent occurrence because someone comes in that may need dialysis, and so they like to have those beds that are closer to the door. So we can look up the patients also by unit, which I like to do just to make sure I haven't missed anybody. So if you look on the current inpatient census enhanced, it always starts with Unit 101, which is our ICU, and many times the patients are actually assigned to 102, and then the overflow goes to 101. So here you can see a patient for Dr. Oakes, which may or may not be someone who is in need of the ICU, but maybe is just an overflow bed. Sometimes our patients go there for overflow or if they're admitted late from surgery. Click on Next Page, and that'll take you to page 2, which is the 102, which is the definitive observation unit. Here you can see this is where Dr. Longjohn's patients, Dr. Oak's patients go. This Dr. Shaw here is Dr. Susan Shaw, who is on the epilepsy service. What you're looking for is ODA. So here's, I clicked on the next page. Here's page 13. This is Unit 904. You can see we have a lot of ODA patients here. Sometimes we'll get consults from Dr. Kazada, who's a cardiologist, or Dr. Kidd, who's an internist, hospitalist. Dr. Abdelmelek also sometimes takes our patients. Here is JPI 1 South, Jacqueline Perry Institute. Here was a patient that was assigned to Dr. Boogie, but ended up here because of isolation issues here, VRE. So even though the patient is in JPI, it's still a patient that is on the ODA service. They do this for billing purposes. Like I said, it's confusing. And then if you click on Retrieve All, maybe you can see it better from this page here. Click on Retrieve All. Then you'll come up with this last page. And I like to look at this one because then you can see how many patients are on the service. And that way it'll help you see if you've missed anybody. I'm going to stop here and I'm going to pick up with my next segment.